Hi, everyone. I'm Kim Dixon. I'm the health editor at Politico. We'd like to welcome you to our latest in a series of health events on antimicrobial resistance. The title may sound alarmist, but we don't necessarily think that's the case. Margaret Chan, as you probably know, has said that the problem of AMR could lead to the end of modern medicine. The task force that Jim O'Neill is leading, that we'll hear from in a minute, has said that if nothing is done by 2050, deaths from AMR could surpass cancer and diabetes. So we're here. We have some newsmakers, some commission officials, industry, and we'd like to talk about sort of how to move forward beyond reports and task force recommendations and to actually concretely trying to get at the problem. So now we'll bring up Xavier Prats Monné for a chat about what Mr. O'Neill said. Well, as you know, this is the Director General of DJ SANTE. Thank you for coming.
Hi.
Jim O'Neill touched upon many things: the demand side, the supply side, the role of patients, the role of doctors. What are your sort of initial thoughts about some of what he said?
Well, what Jim said is extremely interesting, but maybe I should start by pointing out, well, maybe an optimistic note. For me, a nightmare is something you wake up from. So let's not take too much of a gloomy picture. But it's true that we have a real challenge, and I think perhaps the most interesting thing is not just what Jim said, but the fact that he said it from his office, because his office is in the Treasury. His, I think, official title is Commercial Secretary of the Treasury, the City Minister. And it's really interesting that the review that the UK has engaged on AMR is taken from the point of view of somebody who is a distinguished economist from the Treasury as a macroeconomic issue. Now, that doesn't take away anything from the importance, the gravity, or the need to act on AMR, both from a veterinary and human health point of view. But it gives us a sense of something extremely important, which is that we really must put this issue far higher on the agenda of the global community, and certainly Europe. And this will not be done by only focusing on the professionals, the specialists who work in this area. In a way, if, as the Jim O'Neill review says itself, if AMR is a threat to the health and wealth of nations, so not just another big problem, then it's in the order of climate change. And it's a bit the same. We had for a long time the scientific community agreeing completely that climate change was a big issue. What was needed is to bring this at the attention of the general public and the top leadership of the international community. And that's where we still have to go. Now, I think that this is really the critical point. What he says about awareness is absolutely true. We've gone a long way, but we still have to go a further way. I'm sure that maybe even somebody in this room who is not in this business may be tempted to think that AMR is about the resistance that human beings develop. But no, this is the resistance that bugs develop, that outsmart antibiotics. So we have to raise the level of awareness. We have to indeed look at education and indeed of innovation in science. And my last point, I know you don't want me to speak for a long time, my last point is that, for the Commission, for my own department, for myself personally, this is a critically important issue, not because it's an important challenge. There's more important challenges we can point a stick at in Europe, but because it's an important challenge where I'm completely convinced that the EU can help. And this is really the yardstick, EU added value. And I have no doubt that there's a pretty strong, clear added value at EU action on this field, which is the only thing that should concern us.
Okay, so let's start with that. What the EU can do, added value. You're wrapping up a 5-year action plan. Commissioner Andriukaitis gave us some previews last week in Amsterdam, but there are many things on this list that have not been done. There's an action plan. What specifically can the EU do, given the role of health, the lack of competence, and the primacy of the national member states?
Yeah, well, I understand that one should develop a healthy allergy to the World Action Plan, because it's the sort of things you do when you don't know really how to make a difference. But I think that, and we will show it in the external assessment of our plan, we will show that the plan has had success, but also that the measures taken so far are not commensurate to the gravity of the situation. So we will not paint a rosy picture, but we have done quite a few things. I'll give you a couple of examples. you mentioned human health. Well, it's true that one area where we see that not enough progress has been made is in the field of human health, for example, as concerns the prudent use of antibiotics in human health. And it's a huge area. We could do more. I'll be delighted to say what we can do at the European level. But on the veterinary side, we have now, and not enough people know this, we have now not just extraordinary exemplary behavior on the part of our member states compared to other parts of the world in the prohibiting of use of antibiotics for growth purposes in animals, but also we have legislation in place, which will be soon concluded, on animal feed and veterinary medicine that give us really the opportunity to end the use, or rather the abuse of antibiotics.
But there's still some opposition there. That still has a ways to go. It's the vote in the first committee is happening today.
Yeah.
What about opposition from member states?
Yeah. Well, I'd say two things there. Well, we had this conference, as you know, with the Dutch presidency. It brought together ministers of health and agriculture, which is in itself a sign that we do have to take this issue together. And we saw quite a lot of political will to go beyond good words. Of course, we have to test this, but we'll test this pretty soon. We are now starting, after that conference, we have a mandate to start a road towards council conclusions in the month of June. We'll see what ministers can bring together. But I would have thought that in this particular field, well, first, of course, we should not be simplistic. The Commission itself, when it comes to the use of antibiotics for prevention in medicine, of course, there may be some cases, for example, for surgical reasons, where you may want to use it, but there's no reason why we should not really forbid the use of antibiotics in animal use at a far larger scale than we have until now. I don't think that there will be a strong opposition from members. We will see.
What can we expect in council conclusions, like concrete things?
Yeah, well, there's many things, but I think there's a few things that will be a test whether there is more than just will. One is a very simple one, targets. If we want to be serious in not just achieving something, but also being able to measure that and to enforce it, we have to have targets as to where we want to be, how we want to get there, and how we're going to measure it. And this can be done pretty easily. We have a lot of expertise, including in the Commission with our agencies, the Food Safety Agency, and we have quite a lot of capacity to, if member states are willing, to monitor and follow what is being done on the use of antibiotics, both for veterinary and human. So the first thing I would say is targets, but then of course we have to make sure that we make a strong effort indeed on research. Jim put it very well. There's a very little likelihood that we will discover fantastic new vaccines, new antibiotics that on top of that will not develop resistance. But on many areas, particularly on early diagnostics, we can do a lot. And here we can have soft but effective EU tools. For example, this year we'll be giving a prize for an innovative early diagnostics for upper respiratory tract infection, which is a typical case of the abuse of antibiotics. There's too many cases where, in doubt of whether it's a virus or an infection, in doubt, human patients are prescribed antibiotics where they wouldn't have to because of a lack of a quick diagnosis on site. So I think there's no shortage of strength in what we can do. Having said that, if we want to go one step beyond what has been done so far, we have to, I think, do a bigger effort also at the global scale. It's not just what we can do to support our countries, because, antibiotics travel, and the global situation is far worse than in Europe overall. So we have to see what we can do, and the most immediate thing we could do is to support what is already there at the global level, which is WHO. WHO has a global action plan from May, I think, last year, with a commitment by member states to produce national plans by the middle of next year. Let's make sure the EU sets the example by putting coherent, implementable, operational action plans for the reduction of AMR.
So what did you take away from the meeting that you had in Amsterdam with health and agricultural ministers?
Well, as I said, being an optimist, I think it was good news that there was a very strong assertion, a very assertive statement by ministers that they want to do something, especially, I must say, it's not politically correct to single out countries, but I must say that the Dutch presidency, both the Ministry of Health and Agriculture, was really, really driving this process to make sure that countries commit themselves. So what I took away is a willingness to see that we really take measures at the right level, including, by the way, in fora that have not been explored enough so far, the G7, the G20, because indeed, if this is a macroeconomic issue, we should make sure the finance ministers are involved. The other thing I take off from the conference is that many countries are doing many things, and this raises immediately the appetite of any serious Commission official that maybe this could be shared, and maybe we could do some peer review, apart from exchanging niceties about successes. We should really see the shortcomings. And lastly, I would say a question, because I think that the real thing is whether we can go from a political commitment indeed to actual implementation with involvement of the many stakeholders beyond the ministries present in that room that have to participate. Industry, for example, and maybe even above all the professionals of health. Because it is, if we need innovation in health for AMR, it's essentially frugal innovation. It's having a clear, interesting, attractive, effective way to make sure that nurses, doctors know how to prevent and reduce infection. That is, the real thing. And this can, by the way, very easily be transferred. I mean, the problem with best practices is that they don't travel very well. But guidance for the healthcare professionals, incentives for healthcare, this is something that can be done.
What type of incentives are you talking about?
Well, I think that, if you look at the healthcare profession, it's a bit like education. Right? It's a profession that is full of women. And that gives you already an indication of what profession it is. It's a profession that is complex, that is socially useful, and not very well paid. That's what it is. So already making sure that we have professionals that are well rewarded, that have clear guidance, that know that, they, for example, they'll be rewarded professionally if they produce results. And this can be tested. I mean, in a hospital, you can see very well how many infections there are. I mean, the beauty of this is that policy works, and policy can be simple. I mean, if you look at, everybody talks about differences in any kind of health aspects between EU countries, never mind worldwide. But the differences are between and within hospitals. I mean, there is so much proof that good practice, when identified and transmitted intelligently, works, that it would be shameful if we don't use it in something as important as AMR.
Let me ask you one more question, and then we'll open it up to the floor. There was a report that came out in association with the Amsterdam conference, and it had some interesting ideas for concrete, strategies to move forward. And one of them was exploring a European joint procurement for high-value antibiotics. Yeah. What do you think about that?
Yeah, I'd say two things. Again, every time we talk about new antibiotics, let's forget it's damn difficult. Huh? I mean, I am a bit, how should I put this? It would be counterproductive for everybody if we focus too much attention on the development of new antibiotics as the solution for AMR. Having said that, that is a promising thing, because indeed joint procurement is a pretty, has the beauty of simplicity. Why not put together the efforts of different members, especially small member states, into joint procurement that can be in everybody's interest? Now, the caveat here is that the Commission cannot push. We cannot tell countries how to organize expenditure in healthcare, but those who want to use the instrument of joint procurement is there. It's been used already, it can be used again. So yes, I think it's an excellent idea, and we'll be delighted to see an effort to really have this as one of other incentives to produce innovation that would be conducive to better treatment of antibiotics. Let me just again stress that if there are promising areas for research, for innovation, including for joint procurement, this is essentially in areas that are very important, but not necessarily linked to new development of antibiotics. Huh? So, diagnosis, for example, is an obvious. Jim mentioned it himself. Right?
Okay, we'll take a couple of questions before we invite the panel up.
Hi, Nusra Vanches from Changing Markets. We are co-authors of the report called Bad Medicine, which talks about pollution in pharmaceutical supply chain. And this is something where EU action would also be very welcome, let's put it like that. You could introduce environmental criteria in GMP. So I was wondering where the Commission is with that. Are you thinking of addressing this problem? Because the situation in China and India is really bad, and it also contributes to AMR.
Absolutely. I mean, as I said, we cannot treat AMR just as a European problem. You mentioned China. In China, I heard from I'm not making this up, I heard from the WHO representative in China that there are some reports that say that in some Chinese rivers, the concentration of antibiotics in the water is higher than what is allowed in the human bloodstream. So it's pretty serious thing. That's mostly because in China you have 700 million pigs. That's about 60% of the world pig population. And in any pigsty, 5% of the pigs will have to be disposed of. And there's no way the 400,000 poor Chinese farmers can dispose of those pigs in a proper way. In the human side in China, you have 26,000 hospitals in China. And half of the income of the hospitals and the doctors comes from prescriptions. And the incentive for prescription is therefore huge. And what do they prescribe? The easiest thing that actually patients demand, which is antibiotics, including for the common flu, where antibiotics have no role. So, indeed, we should really look at this in the bigger picture, which means that we should engage as much as we can as European Union, individual member states, international fora. This is, for example, the Codex Alimentarius, a forgotten institution that is critically important for international norms of antibiotics. This year, there will be AMR on the agenda. I can tell you that the Commission representatives, my department, in the Codex will be very forceful there. Same thing when we look at trade, our trade relations with our partners, when we look at what we can do in terms of training with other countries. We have, I think, an unexploited potential in what was called until last month the Food and Veterinary Office of the Commission. It is actually a directorate of my department, which is now called Audit and Analysis Department. We have already a training program. We could do much more as a systematic training program for EU and non-EU countries for better use of antibiotics. So there's a lot of things we can do, and there's a lot of things we can do also engaging with the pharmaceutical sector, both general medicines and both generics and medicines, because it's difficult to imagine that without, for example, an incentive for less marketing efforts on antibiotics, we'll get anywhere. So let's take this as the serious issue that it is, where we need really the engagement of many stakeholders, not just public administrations.